Sadly, 1 in 7 children in South Sudan die before their 5th birthday, and almost 1 in 27 women die during childbirth. In the UK, this is just 1 in 10,000. To address these alarming statistics, Drs. Anil and Shalini Cherian, supported by AID, have been providing clinical healthcare and midwifery training for the past 5 years.
We have a special focus on health, and that will remain our focus.
Initially, training was conducted during residential courses based in Uganda. But with the easing of hostilities in South Sudan, they've been able to open the Jonglei Health Sciences Institute in Bor, a major town on the Nile, 140 miles north of Juba. There are 31 students in the current cohort. The Jonglei Health Sciences Institute, or JHSI, trains students to clinical officer level. Clinical officers are quicker and cheaper to train than doctors, and once trained are more likely to stay in the country and not be tempted abroad for a better salary. However, clinical officers do many of the same jobs as doctors, and also have a managerial role in health clinics. This is one of the students, Peter, leaving his home early in the morning, heading through Bor on his way to the JHSI. Many students have to walk several hours each day in their daily commute. JHSI combines classroom lessons with practical training and fieldwork surveys. And as can be seen in the centre section in the JHSI crest, there is an overt focus on Christian service, which is acknowledged here by Mark, one of the students.
I will also deliver services to the community, and I also beg God to bless my hands so that people may get healed through my hand, and I want God to use my hand. In fact, this hospital work is good for Christians mainly because it is something related to human life, and our main target as Christians is to save human life, and we don't want to see anybody suffering. So that's why we are ever willing to have this knowledge so that we may help others who are in need of this knowledge that we may acquire from here.
As well as training clinical officers and midwives to serve the people of South Sudan, Anil and Shalini have a vision to establish a medical faculty that is self-sustaining, which will be staffed and run by South Sudanese clinicians. Here we see Deng Mayung, who was a student on their first course back in 2014, now a medical tutor teaching the current cohort.
You have to do it very quick. You have to check the breathing. There's no breathing, you check the pulse. No pulse, you check the heartbeats.
Archbishop Justin Bardi, the primate of the Episcopal Church of South Sudan, seen here, recognises the strategic importance of JHSI.
Yes, Dr. Anil, though he is based in Bor, he's not only serving the Diocese of Bor, he's serving the whole ECS church. Because recently in our standing committee meeting, he came out with a vision and a proposal of how the whole province could carry out a health program within the province, of which the standing committee adopted that and passed it. And we see Anil as a health advisor for the whole province.
When we set out to restart the institute in Bor town, we didn't have any sponsors or any agency backing us up. It was only the courage and encouragement that we got from Anglican International Aid to say, go ahead, we will find the support that you need, that actually enabled us, and we were able to come here and start in a small way, and things have worked out fantastically, much more than what we could imagine. And I think all this is because of the support that we have received from Anglican International Development. We know